Hilary is currently finishing her master's at Mount St. Vincent University, and she's studying infant feeding. She'll present a talk on infant feeding during COVID-19 in Nova Scotia. Hilary has a Bachelor of Science in Biochemistry from Memorial, and she also has a Bachelor of Science in Nutrition from Acadia. And she's now a master's student in the Applied Human Nutrition Lab, as I noted, at Mount St. Vincent, and completing a dietetics internship. So we have another very busy scientist. And in her master's, she's focused on mother-child interactions during breastfeeding here in Nova Scotia, but also in Cambodia. As Hilary shared with me before the talk, and maybe she'll discuss this a bit, the talk that she'll be sharing, the information she's sharing today is actually just a side project of her research that her and a number of her lab mates began working on when the pandemic hit. So as with the other speakers, we can see the resilience of these students and the research that they're doing as they pivoted to new directions. So with that, Hilary, I'll let you take over.
Thank you so much. Yeah, it was definitely a group effort. This project was among the students in the Mama Lab, which is our lab under Dr. Kylie Whitfield at the Mount. So today I'll be presenting on that project, infant feeding changes and experiences of Nova Scotian caregivers during the COVID-19 pandemic. So when the pandemic first hit, we had a lot of data on infant feeding during emergencies, but these emergencies were things like hurricanes in low-income countries where people didn't have clean water. So what we were looking at was very, very different. We had no idea what we were expecting or what to expect. So in Nova Scotia in particular, we have very low rates of breastfeeding. We only have 22% of infants exclusively breastfed until 6 months, and that's the WHO recommendation, versus 33% nationally. So we have one of the lowest rates. And we have this kind of breastfeeding taboo. It's not really a cultural norm here. And then there's this documented growing problem of infant food insecurity and the affordability of feeding a baby in Nova Scotia. So with these current issues going on, and then the COVID-19 pandemic with really unknown impacts, we decided to explore how the caregivers of infants who were less than 6 months old were perceiving changes to infant feeding and other food and health related matters during COVID-19 in Nova Scotia. So we created an online survey. It was open for about a month. It was early in the pandemic. It didn't seem like it at the time. And it was open to primary caregivers of an infant less than 6 months old. So if you can remember, during this time, there were a lot of restrictions, and that included a lot of cancellations and postponing of lactation support appointments and a lot of postnatal checkups, these normal weigh-ins, things like that. So we collected data on the characteristics of both the participant, the caregiver, and their household, things like their income, marital status, your normal data. And then we also asked open and close-ended questions about their knowledge and behaviors around COVID-19, their concerns, their stresses, and how that might have impacted infant food and feeding. We had 335 participants. We asked for primary caregivers. They ended up being 99% female. Most of them were white, 60% were breastfeeding, so the rest were either formula feeding or mixed feeding. 77% of them were receiving some kind of paid parental leave or parental EI, and 71% of them said that their household income was over the median Nova Scotia household income of $60,000 a year. Over half of them reported no changes in their source of income throughout the pandemic. So this was a pretty highly privileged bunch. And this is why we think that we didn't actually see a whole lot of changes to infant feeding. We saw a lot of stresses and a lot of concerns, but this didn't actually translate into a lot of change, which is reassuring. The changes that we did see were in pumping. So a lot of parents were pumping less because they weren't going anywhere, or pumping more in order to build a stash in case mom were to be hospitalized. And then this had impacts on feeding modality. So how often babies were being fed from the breast versus from the bottle. And then some of the other issues that came up that might have impacted infant feeding were things like access to formula, which then had impacts on the introduction of solids. So all of these babies are less than 6 months old, and the recommendation is to introduce solids at 6 months. So keep that in mind. So there were impacts on introducing solids, and then there were a lot of impacts from issues with access to supports. So with regards to access to formula, we had 49 participants who reported being worried about affording formula, the finances of it. And then 25 people commented in open-ended questions about issues with physical access. So going to many different grocery stores in order to find their formula. And this mom summed it up nicely by saying that her top concern was not being able to find my daughter's formula. I've spent hours crying over this. She has an intolerance to lactose and is on a brand of formula. Now with people stockpiling and hoarding formula, I worry I won't find this for her. And this was common, especially among people who were feeding specialized formula like low lactose or not cow's milk based formulas. And we also saw this very interesting aspect of brand loyalty among parents. We did find, because of these issues with access to formula, we had one participant who reported replacing formula with water or watering it down, which can be very dangerous. And then we had 2 participants who reported feeding solids in order to conserve their formula. So these babies are less than 6 months old. We also had 4 participants who reported that they introduced solids earlier than they had expected due to COVID-19, and this was usually due to infant boredom, which is interesting. This mom says that more time at home has led to increased meals at the table for our family, and the baby showed interest in food. Also, it was something different to stimulate my baby in the absence of community programs, baby groups, scenery changes, etc. And this was a common theme throughout too, accessing of community programs that people normally would be able to go to socialize and check in on their babies. But we had 47 other participants who reported issues with accessing the supports that they felt they needed. And this mom says it has been isolating, being separated from family and friends and not being able to engage in public health drop-ins or breastfeeding in baby groups has been challenging. I've also felt my health postpartum is or was more neglected by myself due to the inconvenience of medical appointments and the closure of clinics. So we heard a lot about in-person support not being available. We also heard specific comments about people being upset that their public health nurse had been reassigned. And we also heard a lot of participants feeling scared or feeling stressed of going to appointments because of the risk of infection. We asked about stress. We used the perceived stress scale, which categorized the participants into low, moderate, or high levels of perceived stress. And 77% of our participants were experiencing moderate perceived stress. Interestingly, there were no differences in stress levels between breastfeeding, formula feeding, and mixed feeding caregivers, which was also very interesting. And then we asked about specific concerns that we thought might come up. So these are investigator-generated concerns. In the darker gray, these are the number of people who are often or always concerned, and in black is never or rarely. So you can see that most of what we asked about, most of their top concerns were about missing health checkups, going outside in general, and infant feeding if the mother were to contract COVID-19. And then in open-ended questions, when we asked caregivers what their top concern was, of course, the top concern was COVID-19 infection, either of their baby or of themselves. There were also a lot of comments just about general stress and anxiety around the pandemic, and then access to infant formula. One of the other common concerns was their baby's growth. So a lot of times this was paired with common misconceptions. So we had 2 participants who specifically were concerned about their own diet quality and their milk, which isn't usually an issue. And then 9 participants talked about this perceived low milk supply and worrying that stress was going to cause their milk supply to drop, which also isn't always an issue or doesn't have to be. So this mom here says, I feel like the stress made me unable to produce enough milk for him. Also, me not knowing his weight weekly from public health and doctors scared me into switching to formula since it guaranteed him gaining weight, which isn't true, but formula is a lot easier to track intake so that you can kind of keep an eye on your baby's growth and what they're eating. Among formula feeders, we found this overarching theme of guilt and shame. So this mom sums it up really nicely, and she says, I find it especially stressful and guilt-inducing to be formula feeding. I already felt guilty because of all the breast is best encouragement, and I tried so hard to breastfeed. I felt like a failure for not succeeding with it and have been ashamed. Now formula is hard to acquire, and I'm worried about the supply chain. So we had several comments like this. Guilt or shame from parents over choosing this less reliable feeding method during this emergency. Now, among all of those negative experiences, there were also positive experiences. So there were a lot of general comments about more time at home with their baby, less visitors, cherishing that time, especially with people off work. And then we had 33 positive comments specifically about breastfeeding in a pandemic. So talking about less pressure to perform for people, less breastfeeding in public. And then this really interesting idea of more intentional feeding or more feeding on demand. So this mom says, we're together at home all the time and no one can come over. We spend most of our days topless and skin to skin. So she's fed a lot more unrestricted than if we were permitted to go places or have visitors. So overall, in conclusion, we saw a lot of stresses and concerns, but these led to very little change, potentially because of that highly privileged group and who had a very strong support system. The issues that we did see were issues that were already happening and that we were already aware of in Nova Scotia, but were exacerbated or made worse by the pandemic, by the extra stress and concerns. Things like the vulnerability of formula-fed infants to financial changes and to changes in the supply chain. And then these common misconceptions like perceived low milk supply, which is a very common reason why women stop breastfeeding, even though it isn't always true. We also saw this really big importance of healthcare and support and a real strong reliance on public health nurses in these community check-ins, not just for catching issues with infants' growth, but also in reducing stress on the parents and ensuring them that their baby is growing okay. And then, of course, we think that there are probably more issues being faced in more vulnerable populations that we weren't able to capture. So what can we do about it? So we held some workshops with community and clinical stakeholders, and these are themes that came out of those discussions that tackled not just the COVID-19 issues, but the issues that were happening before. And so for families, this might look like so encouraging more peer-based supports and virtual supports. This might look like having a wider support network so you have more places to turn, attending those virtual support, support systems that are now available across the country. So we had participants who were very glad to be able to attend prenatal classes with their sister who was pregnant in Alberta. And then sharing evidence-based information or looking for evidence-based information, looking for those .org websites, looking for .ca. The Mama Lab Facebook page always links to very reputable sources, and we share lots of information. Based on these discussions, we have released videos of question periods with lactation consultants and a lot of other educational pieces just to help parents kind of make it through when they can't access those supports. And then modifying messages beyond just breast is best in order to help parents feel more confident in their ability to feed their babies and make sure that they're growing properly and giving them the tools to do that. So letting them know that they can keep an eye on wet diapers to make sure that their baby's growing properly, or watching to make sure their baby grows out of their clothes eventually. Things like that to make sure that they're growing rather than relying on these systems that might not always be available. And of course, as usual, always considering a new caregiver's personal context, because it's a stressful time and we have no idea what might be informing their feeding decisions or any other decisions. thank you very much for listening. Thanks to all the parents who took time to participate, because it was not a short survey. Nova Scotia COVID-19 Health Research Coalition for funding, and of course the Mama Lab team, who all had their own master's projects on the go at the same time, and we all stuck with it. So
amazing. It is very impressive, the work that you have all done on this